Hello, my name is Michael Martinez. I'm a bariatric and foregut surgeon at the Advanced Weight Loss Center at Texas Digestive Specialists. And today I'm joined by my physician assistant and brother, who actually is a first surgical assistant in the operating room as well as works with me in the clinic, Matthew Martinez. And we're here together to help you figure out whether you could be a candidate for weight loss surgery.
So one of the common questions that we always get is, who is a candidate for bariatric surgery?
That's right, and that's really the starting point. So I should tell you, actually, there's some new recommendations that have just come down the pike, and this is actually brand new information. It's still something that insurance companies have not yet adopted, but typically if a patient has any medical issues associated with being overweight, then they should be considered for weight loss surgery. But there are certain stipulations on insurance companies paying for those patients to go through with surgery. And so we know there are certain medical requirements. And what has happened here recently, the new recommendations have come down that patients at a lower weight should be considered for weight loss surgery. And the reason is that surgery has become so much safer in recent years. We now do things with minimally invasive techniques. We do things with small incisions, putting cameras inside the patient, and most patients are actually in and out of the hospital within a day or two. And because of that, because of the increase in safety and now better understanding of the benefits of surgery, candidates should be considered at a lower weight. The specifics are unique sometimes to different individual insurance plans, and so that's something that we can talk about in the office. But if you have any question that weight may be affecting your quality of life or your medical conditions, you should come to see us. Another question that I often get from patients is, tell me about the benefits of weight loss surgery or of losing weight through bariatric surgery. And I think that's something that you get as well, because you work with our patients both in the preoperative setting as well as in the postoperative setting.
That's correct, and the benefits are many. So from simple things like bending over to tie their shoelaces, walking up and down stairs, patients that take medications for things like diabetes and high blood pressure, those things can go away. So medicines get less, medical problems that are chronic become easier to deal with. Even things like sleeping become easier.
You know, I used to emphasize when I would have these conversations with patients about the increase in life. It's been studied, it's very well documented. Any patient that goes through bariatric surgery tends to have a longer lifespan on average than people that they're compared to. But I went away from that actually after a patient who had very serious chronic back pain, multiple back operations on their spine. And she kind of reprimanded me when I was talking to her about living longer. She said, I don't want to live any longer than I have to. I just want to have a better quality, lower pain life for the rest of my days. And it really changed my perspective to understand that what is so important to the patients from a benefit standpoint is that everyday benefit that you spoke of, being able to tie your shoes easier, being able to get in and out of a booth at a restaurant, being able to fly on a plane and fit in a plane seat. All these things that a lot of people take for granted that affect your everyday quality of life, those things I find are far more important than the number of blood pressure drugs that you may be getting rid of, although those things are very important as well.
You know, another question we get is, which is the best weight loss surgery? Which is the weight loss surgery for me? In our office, we do two different ones. We do sleeve, we do bypass.
Correct. And actually, that's part of a spectrum of weight loss procedures that we offer. So sleeve and bypass are the predominant, most popular procedures for the vast majority of patients. But what is really important to understand is, if you're going to go through a surgical process, you need an individualized surgical process. This is a medical treatment like any other. And so the analogy I like to use is, if somebody is getting treatment for their cancer, let's just use the example of breast cancer. Some patient may go to surgery first, may come back with radiation afterwards or chemotherapy. Some patient may start with radiation or chemotherapy and then go to surgery. Some may not need surgery at all. It's very individualized. And then you can have recurrences of the cancer that would cause another round of treatments. Well, in the case of bariatric surgery, it's important to understand medical conditions, age of the patient, lifestyle of the patient, what previous surgeries they've had. All of these things affect our decision making on what's the right kind of procedure. So even though sleeve and bypass are currently the most popular surgeries, there's a whole spectrum of treatments that are offered, including even non-surgical weight loss. And so sometimes we have candidates that are more appropriate for something like that. And let's talk a little bit about the process for bariatric surgery, because inevitably it comes up. Well, okay, well now I think I might be a candidate. I think I want to have those benefits in my life. What are the actual steps I have to take, or what does it entail? Can I just decide to get surgery today and then go get surgery tomorrow? And we know that it's not that simple.
No, it's not, but you alluded to it too. So even offering things like non-surgical weight loss. So what I recommend, if anyone wants to have weight loss surgery or just is considering weight loss, you can come into the clinic. If you do not have benefits, then we can do non-surgical weight loss, including things like medications. But if you are going to have surgery, the thing that you have to know is that our staff is there to work with you from the very beginning. So making sure that you have insurance, insurance coverage, make sure all the visits like cardiology, pulmonary, everything to get you cleared for surgery, make sure that those things happen as they should. Our staff is there to back you up.
It's really important because this is a process, and oftentimes insurance companies will put very specific requirements for you to get through the process if they're going to be contributing to the payments on the surgery. And so what that can entail for us, always as kind of a baseline, is checking out your overall health through labs, through cardiology visits, sometimes pulmonary visit, which is looking at the lungs and function of the lungs. We oftentimes will have you see a dietitian as well, so you learn how to eat before, during, and after the procedures. Everybody is required to see a psychiatrist as well. That's an integral part of the process so that we can make sure you don't have any eating disorders, any addiction issues, or things that can rear their heads long-term after the procedure and make it not as safe for you. And the other part of it is a check on the anatomy, which we usually do through endoscopy. So putting a scope down and taking a look at the actual stomach and the organs that we're gonna be operating on. We wanna make sure there's nothing there that's gonna alter our ability to do the surgery. But sometimes we use imaging or other modalities depending on the specific needs of the patient. If this is a topic that interests you for health reasons or a family member of yours that you think might get some benefit, we at Texas Digestive Specialists, and specifically the Advanced Weight Loss Center, are here to help you. We work as family, we treat you like family, and we understand this is a lifelong disease process. So thank you for joining us today, and we will see you next time.
Texas Digestive Specialists, the premier comprehensive digestive health group in the Rio Grande Valley.